Hi. When I buy something from Amazon, a week or two or even less, they ask me how did the purchase go, was I happy with it, etc. When I buy things from eBay, the same thing happens. Okay, it's not that personal, but it is a follow-up. So the same thing happens with eBay. When I buy something on eBay, they ask me mostly, maybe not all the time, how happy I was with the purchase. When I get my car serviced, someone follows up and asks me, was the service to my liking? Now, this happens in a lot of areas. Sometimes I get a service request and I just don't reply. I'm lazy or just can't be bothered or think it's of no consequence. However, when I go to the doctor, and this has been true of all doctors, and I've got a health issue, they give me a tablet. It might be a blood pressure tablet, might be a tablet for gout, might be an extra tablet for blood pressure. It might be a sleeping tablet. They don't follow up. The nurse doesn't follow up. The doctor doesn't ring me up. Occasionally, doctors will say, come back next week, but not usually. Now, the only thing doctors are offering these days is a bit of advice sometimes and a pill. It's as someone said, if they don't offer more than the pill, then they're just actually drug dealers for Big Pharma. And I can see some truth in that. So it's very important that they follow up when you're taking a tablet, almost any tablet, because all tablets have side effects. When I was younger, they had minimal side effects. Now I'm older, the side effects occur almost with every tablet. But the doctors aren't concerned with that at all. And they're gambling with a lot of the tablets. They don't know whether the tablet is perfectly suited, let alone generally suited to you. They're just prescribing what doctors prescribe. You're an individual, you're older. All these are variables. Now, I've had 3 doctors recently. I'm at an aged care place at the present time. Maybe I won't stay here forever, but I've been unwell. The first doctor I was assigned, I had a urinary tract infection, and the pathology lab prescribed 2 drugs. Now, recently, last year and a half, I've got into ChatGPT. So he wanted me to take the first of these 2 drugs. So I looked it up on ChatGPT, which is particularly good on medicine, I think. Some of the other AIs are good, but I think ChatGPT is good in certain areas, and medicine is one where it's better than most doctors. That's my view. That's my experience. And the drug biotic that was prescribed for me, it said it's not going to work with this particular bacteria, which is a bit of a stubborn bacteria. So I typed in the bacteria and I typed in the drug that was recommended. It was actually recommended by the pathology lab. So I thought I'd try. I'd say to the doctor, well, I won't take that one. Apparently it's not going to work. So the second one, it said, this drug may work, but it's got a lot of side effects, including neurological side effects, and you've got peripheral neuropathy. and some of the side effects don't even go away when you stop taking the drug. Well, this was the second choice. I rang up a friend of mine who's a medical researcher, and he said he knows the drug and he's not as concerned as AI about it. And he said, I don't think he'll have the side effects. Anyhow, I took it. I haven't been particularly well in the 3 months after I took it, maybe 2.5 months. But I don't know whether that's me or the tablet. But this particular tablet, when I further investigated it, it said, this tablet is not good for someone who's old, and I'm 80. It said, particularly for 80-year-olds, there are alternative drugs that are just as good and will handle this bacteria. But the doctor, he didn't do his homework. He just followed what the clinical labs said. In fact, I didn't even see him. It was all done, as happens now, by email and text. I didn't even speak to him. It came through a nurse. Anyhow, the next time I saw him, I had a problem with my ear, and an audiologist had recommended some drops because she said, you haven't got wax blockage, you've got a dermatological problem in your ear, and this is what I think might be suitable. So the doctor had to prescribe it, the audiologist couldn't, so he prescribed it. And he said take it for 40 days, but when you look it up on the web, on ChatGPT, it says don't take this drug more than 10 days and certainly not more than 14, unless it's very, very carefully supervised. It's got cortisone in it and some other elements. The cortisone, if you take it too much, it'll thin the skin in your ear considerably and you'll be much worse off. And you might develop a fungus as well. So I took it for 10 days, not the 40 days he recommended, and it did seem to help. I asked him to have a look in the ear to see how well or whether it had worked appropriately, because I felt it had worked. The ear was less itchy, but he didn't want to look in the ear. He said, no. I said, can you have a look at my feet? They're swollen. No. He'd previously said, it's caused by the Xandip. That's another story. Anyhow, when I looked up Xandip and swelling, yes, a common side effect, particularly in older people, is swelling. Are there alternative drugs that may not cause swelling? Yes, there are. But he didn't prescribe those. The swelling in the legs, he didn't investigate. Here's what they could be due to. Could be due to the heart. Could be due to the kidney. Could be due to the liver. Could be due to other tablets. Could be due to what's called venous insufficiency. Those weren't even explored. And the diuretic you use depends on the cause of the swelling. With venous insufficiency, which I think I have, which I've diagnosed myself by process of elimination, but I can't be sure it's right, although I did kind of put it past a cardiologist at Concord Hospital. It's not spiroactin, the diuretic I'm taking, isn't going to work with this particular problem, venous insufficiency, which is where the veins are blocked or the valves aren't working properly, if that's the right term. If it's other kinds of swelling, spiroactin may work. There's also a stronger one called LASIK. But none of these things were canvassed. And in the nursing home, doctors have never spent more than 3 minutes with me. They just can't get out of the room quick enough. I've got to see another patient. And they're collecting, in terms of my research, $105 for the first patient and about $50 for the second patient, and that's for 3 minutes work. So, there's problems with doctors' follow-up. There's even problems with asking doctors to check on things. Are they too busy? Don't they care? And I actually think there's a lot that don't know. Now, I had fairly good doctors in the past, particularly GPs. Had a few duds, but basically pretty good. And this spate of 3 doctors that just don't care, don't know, or haven't got time, whatever, is appalling. Another doctor didn't even come in the room. He did his prescription from the doorway. He said put on 3 layers of bandage for the swollen ankles. And I said to him, 3 layers of bandage? I said there's actually different grades of elastic bandage, from very firm to moderate to not so strong. Oh, he said, no, I want you to put on 3 layers, 3 layers. I spoke to the nurses and other people, and they said, we'd never put on 3 layers. We might put on 2, but never 3. And AI, ChatGPT, said, you'll cut off the circulation. So I just said to him, look, this is not good. I don't want to see you again. He came along again. I said, I don't want to see you. So there's the problems. He also prescribed a drug for constipation. He didn't consider the other drugs I was taking, because you can't take it in the morning if you're taking these other particular drugs. Then the third doctor that I've had recently, once again, too much of a hurry. She says, I heard you had trouble with 2 other doctors. I said, no, they just weren't good enough. She didn't like that. Of course she didn't. And I'm not out to criticise doctors. I'm happy if I get a reasonable doctor. Anyhow, she just didn't spend time. She's in a rush, probably semi-retired. And I said, look, I'm taking a particular blood pressure tablet called atenolol, and there's another one called metropolol. The atenolol one causes some problems and isn't necessarily best for older people. The metropolol, which I had taken in the past, might be better. Well, she didn't even know what I was talking about. These are beta blockers. She would know what a beta blocker is, but she had no idea about the comparison of the tablets. Anyhow, I've got to keep someone to write out referrals to specialists or change medications. So I'm kind of sticking with her, but not good. Not good at all. So that's some of my experience with doctors. 1, as I said, they're in a hurry. 2, they may not care. And 3, they don't know. It's a bit of a worry. Of course, they know some things, but they're a bit shallow on other areas. It's hard being a GP and knowing about all drugs and all illnesses, but they could do their homework just like I did as a teacher when I didn't know enough about the topic. But they don't seem to want to do that. They just want their handout, and the patient is the ATM. It's a bit of a sausage factory. It's a bit of an assembly line. It's a bit of a scam, modern medicine. Some things work. There's some operations like a knee replacement can work, a hip replacement, a valve replacement. those kind of hardware issues, doctors are sometimes wonderful. But on the tablet level and on the psychiatric level, pretty terrible. And they just follow guidelines rather than considering the patient. I've tolerated all this, but in the last 2 years, and particularly the last year, I can't tolerate this. I let them know nicely that I don't want to see them again. I just have no faith in the modern medical system. I could go on about another case, but I'll just stop there. So doctors have got to follow up with you and ask you, how are the tablets going? What are any side effects? Have you got any benefit? Should we change to another tablet? But no, they just tend to issue tablets and leave it up to you to come back, and then they collect more money from the visit. Doctors are not concerned with getting you better. They're just concerned with treating symptoms, and some tablets do make you better. And to finally sum it up, I'm suspicious of just about all tablets now. However, I realise some tablets will keep you alive. Some tablets will enable things like operations to take place and for you to recover. Other tablets are kind of in the middle. They may help, and they may help some people and not others. And then you've got a lot of tablets that have just been piled onto people and really aren't doing the job and don't help much, and the side effects often outweigh the benefits. I'm just listening to a discussion by two prominent evolutionary biologists on the effect of Ozempic on people, particularly in the opening part of it, particularly people's hearts. That's Ozempic is the weight loss drug. And there's all kinds of red lights going up in many ways about this drug, which was touted as the miracle drug for losing weight. And it may be for some people, but it does have some issues. I think modern medicine, the doctors and the pharmacists need to have a complete revision. And it's important particularly for older people, but for everyone. The way to treat illness isn't just with a drug, isn't just with an operation. Sometimes an operation is necessary, and sometimes a drug is essential.